Hello, Dr. Freire. Welcome to the International Dentist Podcast. It's great having you here with us today.
Hi, Gabby. You can call me Marcelo. It's my pleasure to be here with you.
Wonderful. I'm more natural calling you Marcelo, so you're making it easy for me. I'm really curious to know how or when did that happen that you chose to come to the United States as a country, and why the United States as a country to practice dentistry?
Yeah, those are good questions. And first of all, thank you so much for inviting me to participate in the podcast. I definitely want to send a message of positivity. And I think one of the main points of choosing here is the main message of America, the American dream, the idea that it's a place of possibilities. It's a place of opportunities. It's a place that I had dreams. If you work hard, if you show up, then you have a return for that. So I was born in Brazil, in a countryside of this Rio de Janeiro state. And I just was really fascinated with research. So it became obvious that US was a good option for my dreams.
How fascinated with research? Like, when do you start noticing that was a fascination of yours?
It was forever. Actually, since I'm a child, I was really curious about a lot of things. Very curious, but at the same time, a lot of daydreaming. So thinking. I spent trips and summer vacations, just thinking about things. And I would consider like looking at the plants and being very curious, asking questions. So for example, during my elementary school, I had a lot of trouble with grades because I would escape from the class. I would get out of the class almost every day. And I would go up to the school top floor of the school, where there's a lab where they have this formalin embedded tissues. So they would have these bizarre beetles or tissues or even fetus and all these jars. So it was my dream to always run there. So I would always get in trouble because I would leave class to go there. So it has been something that's native of my life. And I went for a clinical field, which was dentistry, but it was obvious that science was always part of my life.
And why did you choose dentistry then, when all those curiosities, like there are really a lot of fields in which you could channel those intentions of curiosities, right? Why dentistry?
Yeah, that's interesting. So I did not meet my grandfather or my grandfathers, but they were both dentists and they studied in Europe. And I have books from them from the 1909.
Wow.
If you see the books, one day I will show you the books and maybe I can send you a photo for your podcast if you'd like.
That would be awesome.
Yeah. So those books, you have all types of classical procedures of dentistry. You have also a lot of science. There was a pathology book that he had, and he used to glue. My grandfather, they used to glue on the inside the book some like newspapers, because at the time you wouldn't have like articles. You would have like newspaper articles. So one of them was like how honey, it works as an antibacterial. How people used to use honey properties for antibacterial. Another one was about materials. What's the best material to create a, prosthesis? So I think dentistry, combination of arts and science, was something that was really attractive. I wasn't really attracted to life and death. So it wasn't something that I wanted to be dealing with. And I thought, since I had a history in my family, somehow there was an attraction there,
Yeah, absolutely. And how do you manage to do in dental school? Do you feel like you were more attracted to those topics that were more science related to those clinical ones? Or how do you experience that clinical activity?
Yeah, it was a journey for sure. So the dental school was pretty incredible. I loved all the classes. As I mentioned, I was really curious. So I would ask questions. So sometimes my classmates would be mad at me because I was always asking questions. By the end of the class, everybody wants to get out. I'm asking the next question. And I learned a lot. I would read books. The culture at the time was, people doing summaries and sharing all the summaries, and everybody just memorized the summary. For me, I was curious about books. I would download, try to request PubMed articles and, order them and pay for those articles to come in. I would try to learn English by translating those articles. So clinically, I love my patients. There's a connection that I have with patients that is something very special because you basically translate a lot of your scientific knowledge to that moment, to that person. And I felt there was a responsibility on me that I wanted to do the best for that person. And my focus was always healing, improving inflammation, improving tissue healing, and working with wound healing and all that. So I loved it. And I also, for you that have prosthodontics background, I also did quite good ceramics. So
Really? What? I didn't know that.
yes, because I have a side, I think we all have some different sides, right? And there's a side of me that calms me a lot, calms my mind, which is the artistic side. So I love color, shape, texture, and I think there's a lot of arts and science in dentistry.
Yeah, absolutely. And you channel it through that. Is that something that you do as a hobby still now, or it was a hobby when you were in dental school?
Yeah, it was, I think I actually knew I had artistic desires, but I think prostheses and classes like material science brought on me that I really enjoy. I was doing all this gold infusion for prostheses, doing all these steps, and I was thinking, oh my gosh, could I make a little sculpture here? Could I make something else? So it was, I think my mind was always dreaming that way. I think dental school actually helped me. And today I still paint. I paint things for my office. I send my friends postcards of little paintings. Nothing don't call me a pretentious artist, but it's something that flows in my life.
Well, if it's something that if you're a natural curious person, I think creativity comes along with that, right? It's difficult to control the creative mind. Actually, it cannot be controlled. You just better be channeled through things.
Oh, I love that.
Yeah.
Creativity cannot be controlled, better be channeled. That's a hot moment. Oprah would say, tweet that, please.
Let's talk about how to control the mind. Not just kidding. But then once let's just say you finished dental school, and I'm talking about the Marcelo back in their 20s, and I guess feeling that you were in a country that it was not providing you with what you needed to grow that curiosity, right? Was that the feeling you had when you were there?
I actually was pretty happy the whole time. I received my first scholarship when I was in the second year of dental school to perform a research project. And this scholarship came from another university that had molecular biology, and they liked the idea. And I was surveying pregnant patients, aging patients, and teenage and children to understand how they differ for periodontal disease. So this was second year of dental school. I had a small little grant. In fact, I hired a bus to bring the patients to the school. So I always moving and shaking, but there was that desire oh, I'm reading these papers from these people. For example, I read paper from a professor from USC, then a professor from Forsyth, Harvard, Tufts. So it just inspired me to search for more, but I wasn't unhappy. I was pretty happy.
Do you have anyone advising you and saying, Marcelo, you have to go to the US or telling you or mentoring you somehow into that?
Yeah. Yeah, I'm an associate professor here at J. Craig Vance Institute. And it's the first time that they have a DDS PhD, because this is a biological institute. And there's people and I'll get you the advice, but there's people with different backgrounds, such as ocean biology, or, synthetic biology or microbiome or fungi biology. So it's very diverse, and I bring a lot of oral biology to the group, and the importance of saliva diagnostics, the importance of the mouth as an oral systemic portal. So to get to this point, there were a lot of hurdles, there were a lot of scenarios, there were a lot of struggles, there were a lot of.
Do you mind talking a little bit about those struggles?
See, but in terms of the advice, because I do want to answer your advice, I think if I could, there are many things, but if I could point out one advice is professionalism. Being professional to me doesn't mean to be formal. I think in dentistry and medicine, we confuse, we have to wear a suit, we have to be formal. I know people that are professional here in La Jolla, California, people that are professional wearing sandals and shorts, but it's the idea that you show up to life. You have meetings, you show up. You have a deadline, you finish early. You have a paper to publish, you write the best way you can for that moment. It's not about perfection. No. I think showing up to life, it's about being okay with your mistakes and be okay with your growth, but being there, being present, from what you're doing. I think that to me has been the biggest lesson.
Absolutely, especially considering that at least culturally, I don't know how it is in Brazil. I could talk from my experience in Venezuela. We're not so used to deadlines. We're a little bit more flexible with that in Latin America, right?
Yes, absolutely. And when you come to a different culture, I've seen that a lot. People talking about their cultures and how they are. And I'm like, well, there is a culture here and you better shake it up and adapt. And you have to be native and who you are and bring all your gifts, but you have to adapt and being able to being professional and showing up to life. I think that was the biggest thing that's brought success in my career.
Wonderful. Like if that was something positive, then what will be something negative or something you struggled with?
Yeah.
First cultural encounter.
Yeah. Obviously language. Even though I was in classes in Brazil, I didn't come from a wealthy family in Brazil. I had met a lot of international people that succeeded, but they were already very successful financially in their countries. Not me. I needed scholarships. I needed help. I could not just, be out there doing almost volunteer for every time. I needed, financial support. So I think having the language to pass through the tests for graduate school, pass all the exams. I don't like these standardized exams. Those standardized exams are very robotic, not creative. You had to follow those timelines. It's not for me, but I had to do many of them, as you know, multiple times for multiple applications. So I think language was huge, I remember meeting this professor in California, in Los Angeles. It was a conference for implants in 2006, for implant and perio. It was January 2006. I came in.
You came in from Brazil? Were you in Brazil? And
for this conference, okay. And I had done a work in interleukin genetics in Brazil, and I wanted to show him. And he said, "Hi, nice to meet you." I was paralyzed. Well, that was the level of my English. But I had, I show up to life because I had a monograph. I had that small little thesis written in English that I worked very hard to write, original writing. And he really enjoyed that and was a friend of mine that introduced me to him. And then ended up opening opportunities for my PhD.
That's how you end up coming for your PhD?
Yes.
Yeah. How long after you finished dental school was this? Or it was during dental school?
I was from Rio. I finished dental school there in Brazil. Then in São Paulo, there is this University of São Paulo, which is a well-renowned university for research, where I did my periodontics specialty. And so dental school, then 2 years of periodontics and working. doing my periodontology residency, I was really focused on all this inflammation stuff. And I did a thesis. So during these 2 years, I worked a lot. And then a friend of mine from University of São Paulo introduced me to this professor, which then opened the opportunity for me to realize that the US model was to apply and wait. I had no idea you could apply for many universities. It wasn't my culture. I didn't know the system. So this introduction helped me understand. I had emailed this professor called Roy Page, University of Washington, and he was a famous pathologist for studying blood vessels and oral lesions. But he emailed me back that he retired. And then I asked my friend to translate his email, and she was the one that introduced me. And it was Homazade, professor in USC, that saw the potential. He's like, I think your thesis is very interesting. I work with different aspects of the same topic, and maybe you could really apply here for our USC PhD, Doctor of Philosophy program. And they have one in craniofacial biology. So that was January. That was a conference. And then that same year, May 5th, I came to US.
And didn't go back.
I had jobs. I had stable job. I had my clinic. I had, those jobs that you say that you did like an exam that you passed. You can't lose those jobs, permanent jobs. And I just wanted to try. And there were a lot of hurdles, like the scholarship didn't come through the same time that I thought it was going to come through immediately. I did not have the financial support right away. When I came in, I didn't realize I had to do GRE exam.
You probably didn't even know what that was.
Didn't even know. And I didn't even know I could have applied for other universities, so other labs. And I focused, I stayed loyal, I did everything there. And then only 2007, I was fully admitted in that program. And then I started doing graduate school classes, being with biologists, doing rotations. So in that 2007 was the start of my formal science career.
Okay, so in that previous year, basically was just preparing, but you were here already.
I was here already. I was doing research in the lab. I had done a lot of experiments already. I was just pushing. I was writing, poster for IADR. I was just doing whatever I could to keep moving and studying for the exam.
I can imagine. Not easy at all. Also trying to catch up with the language too, because if the language was a barrier at the beginning, one thing is to write the English, right? And I guess you were writing even in a high level, because writing scientific literature, this is not the common language you're going to speak.
Yes. And what I did was, my strategy was reading books and reading basic biology from books and really sitting down, summarize. I have folders and folders and folders of summaries and notes, ideas. And I took seriously my notes, and I think that's how it helped with language, which I still struggle.
We all do.
And then from that point on, after my graduation, I received a lot of accolades, research awards, grants while I was students. I realized research was part of my career professionally. And from that point on, I applied. People told me, Marcelo, you have to have a clinical certification in the US as well, because if you just do the science right, but you are only doing it as a scientist, you lose all your clinical expertise that you had from Brazil. So you can certify. So I applied for periodontology residency. I applied for 5 places. And I applied for that. And I wanted places that had postdoctoral research opportunities. So I could do postdoctoral clinical, postdoctoral research. And I ended up getting accepted to Columbia, but they only had the next year opportunity, not the year that I wanted. And UCSF, don't fight with me, because if you listen to that, but they didn't accept me because they said I didn't have one translation. So if you're listening to me, get all the translations. That I had all translation, but some sort of misunderstanding that way. And at the end, I only got accepted at Harvard for the D. And that was my own acceptance. And the director, Dr. Nadim Karenbach, suggested me to be in the residency that they have a doctor of medical science. And he would say, why are you a PhD? Would you do that? I actually didn't want. I wanted to do just a certificate, but Harvard provides either master's or doctor of medical science combined with the residency. He suggested the doctor of medical science because I wanted to do postdoc research, postdoc clinical, and that would give me more time. The total program is 4 years, so that would give me more time. So I was at Harvard for my clinical residency and then at Forsyth Institute for my research postdoctoral training under a mentor called Thomas Van Dyke. Yeah.
And that was during the whole 4 years or in the, okay.
But there were a couple of changes that happened. What happened was I received a training grant from Forsyth, from NIH, managed by Forsyth, called T32. So now a lot of institutions have that, it's called T90. But I received that grant to do my research. I was in residency. There was a tailored program to accommodate all these needs. And in the first year, I was discovering a couple of interesting things about immune cells and neutrophils and things of diabetes and inflammation. And then I decided to apply for a bigger grant. And I applied and I got it. And that bigger grant allowed me to have protected time for research and transition me to become a faculty.
During residency or after? Oh,
yes. Because Forsyth and Harvard are two different institutions. So 2 years in after my grant, in 2015 also now 3 years total of residency, I became a faculty at Forsyth and opened my lab in neuroimmunology. So I did my residency, I did my postdoc research, and I transitioned to become a faculty. And then this last year at Harvard, I had to do my doctoral medical science thesis, which I had researched. It wasn't a struggle. We always have to put together thesis, defend, and all that. And it was busy. Boston time was busy. It was like going from Forsyth, which is in Cambridge by MIT, then going to Longwood, getting the T, the red line, the green line. It was something.
Moving around a lot too. You had a busy schedule.
I had a busy schedule. As I mentioned, since I started, always creating, and it was part of my life to be busy. But I also started seeing patients in the faculty practice at Forsyth, and I became full-on faculty once I finished my residency full time, and then it was fascinating to be in the clinic, bringing patients and then being a scientist, doing research. I think the oral immunology, oral microbiology field, it was really, it's really a big field in terms of the oral biology fields,
Absolutely. And you were in a center that was able to provide you with that opportunity as well, because everything is built with that orientation too. So the patient here, it's, I guess, perfect fitting for your capacity and your expertise.
Yeah. And one comment, Dr. Nadim Karenbach is now the dean of Tufts University. So
yeah,
he was the director. He was the person that understood my vision, understood what I wanted to be doing, and provided a way to make that happen. And I think those are good leaders that understand individual needs, and tailor scenarios where you just thrive.
Because you felt in a way, and I guess this is a question, the system wasn't really designed, or the typical things on the website didn't appear to fit your needs at all.
No, and still they are not. And that's a passion of mine, is that clinicians and scientists can to communicate more freely and more openly, that maybe we will have programs that are better tailored for clinical and science. backgrounds. For example, if you have clinics in the morning and then science labs in the afternoons, and who knows, some lectures in between, you could have a better structure. But programs don't have a very well tailored, structure or time to provide to the students to do both. Even Harvard, that's a perfect place for research. It's still a struggle, and the individual, the person, has to be the one that's pushing.
Pushing and also customizing, like being flexible and constantly customizing and adapting, because you were basically juggling and jumping from a place to another just to be able to fulfill everything. And you were lucky to have a person that's had that vision on you, on your talent and your potential, and somehow help, right? So how important it is to find those people in life that are key players.
Yeah, and that's the difference of being a dreamer or being an achiever, is that you can have a vision, but it's not going to come to you waiting in your house. You have to go ask people questions, be curious, ask, may I do this? If I provide, someone says to you, no, I received a lot of no's. You cannot do this. You cannot do that. I said, okay, if I provide your calendar of what I'm thinking for this quarter, would that make it easier? Yeah. Okay. Let me take a look. So then you provide a tailored calendar. You make them happy. Then they work with you. But don't give up when we receive the first no. It's like what Ruth Ginsburg said, lead in a way that you inspire others to join you, so find a way that people join your journey as well. We all have so much passion, but don't hesitate to go to the next step. After the first no, go to the next step. Take a look at this. Let's see, can I adjust? What is it that would help you? What is it that would make you happy? Work with people. And I see a lot of students crying and struggling and with anxiety. And I think a lot of it is not knowing how to deal with rejection,
Is that something that you feel is part of your nature, or how do you feel you learn to be more resilient to the...
Yeah, that's such a good question. I don't know if I know exactly the question, but what comes to mind is, no, no is just a first step.
I love that.
And you already expect that. So if you're going to send it to a journal, you do your best, the best that you can, but there's hope and you have a good positivity, but no is a possibility. And then how do you go from there? So I think I'm truly optimistic. I'm truly kind of in the dreamer side, but I have a realistic side that comes to me every day, every morning to make it happen, no matter what, So I had the issues with visa, and I had the issues dealing with transition from one visa to the other. Today I'm American citizen, but all these struggles are expected. So talk with your colleagues, I think I always talk to people, always ask questions, collected information. And I think that helped me understand that struggles are real. But resilience is important. There were a couple of cries, but it wasn't my nature, to complain, talk about people, and engage in negative loops. It was my nature to, what can we do to improve this? I'm a guy from the countryside of Rio. Campos is a city that's sugarcane field. It's like sugarcane plantations to the right, to the left. I mean, people in my streets, they had not many opportunities. Like, I was dealing with people in very different levels. So I came from true minorities in terms of socioeconomic status. And at Harvard, I received these awards that's here. I'm not sure if you're going to show the video, but I will say this is like a gold plaque. It says James Shaw Award for overall achievement in research training. It's one award for all the specialties.
Wow, something.
You can be humble or, proud or cocky. I rather be super humble, because where I came from and the opportunities that were given, and then also the opportunities that were created, gave me a result, of and accolades. So it was a journey, but it was a positive journey.
It was a positive journey because you have a positive outlook of it. There are definitely multiple struggles. And something that I love you said is how asking questions and talking to people helps somehow normalize the process. And I guess that was my motivation actually when I created the podcast. I said, we all go through this. If you're lucky to have friends that have been through that, you have somebody to call. But what about if you don't? All of us, we started with no knowing anyone. We made friends and we're friends now, and all of that because of the talking and the communication. But I guess, how easy it will be if it's so normal that everybody will talk about the struggles too, because from the struggles came the learning.
Yes. And you're giving accessibility. I didn't have that. I had to really research. I was buying like PubMed articles that were not fully available to my university in Brazil to have access. And now we have accessibility. There's so many websites, so many blogs. So use communication as a tool to your growth. And I think that's what you're doing. It's an amazing job to provide this, opportunity and sharing unique stories. We all, if we all read the same book, we all read a very different story. And that's the uniqueness of humans, that we all live a different book. We all, have a different perspective. And what's amazing is a collective genius, all of us being able to share in a podcast like this, being able to share to each other our collective lessons, our struggles, reality. Then I think we'll help a lot of people, I hope.
I hope so too. I actually heard the other day something that I feel like correlates to this in relation to COVID. They were saying that, how they say, oh, we're all in this storm together. And somebody said, no, we're the same storm, but in different ships. So
yeah,
I guess that plays a role, because the way how you manage the struggle is actually what is going to end up in one result or another. And you talk about your positivity and maybe how your personality and your natural resilience help you. But if you feel something that play against you, could you point out something that play against you, or
yes,
something that was a struggle?
yes, it's excessive creativity. So there's a role for opening doors, which is amazing for science. That's how you discover drugs. That's how you discover the genes. That's how you discover insulin. That's how you do incredible impact. Discovery requires a lot of attention in thinking, or time for thinking, because you are doing something that nobody had done before, and the world is overcrowded. But there is a role for closing the door. So you start something and you finish something. So I am a big door opening. I like opening doors. I like starting projects. I'm not very good in finishing the projects. And I actually learned that all the creatives, all the professors, there's a professor at Forsyth Institute called Sigmund Sokransky, who's the founder of like the microbial clusters and all the bacteria in the mouse, the red complex, orange complex. He was very creative and he never finished a project, but he had a partner that used to finish all the projects. And she used to be an incredible scientist helping him finish all those projects. So I realized that goes against me, because I open a lot of projects, but I'm controlling myself more. I'm learning, and I'm finding people to work together that's like finished, they like closure. They like getting that paper out. So creativity comes. I wake up in the morning thinking and writing, and it comes a lot of creativity through me. So I need help completing the projects. And I noticed that after my PhD, this pattern. And I work and collaborate with people that don't tend to be crazy like me, that tend to be more like, let's finish this by October.
Well, they're going back to the deadlines. I think there are people that are finishers and they really feel the accomplishment coming from the end goal, the satisfaction of the end goal. And they don't have that personality. Like, I'm more like you. So I feel more excited with the process. Like almost not caring about the results so much. Like, oh, if I just get so excited and busy, inspired, pumped, whatever it is, with the process that unless that you either realize that and train yourself or find somebody that overcomes that and work together.
In therapy. But I'll need some levels of therapy.
We all do, especially nowadays with the things happening.
Yeah. And I think the other part that I had to learn in a hard way was that in some ways I have a heart of a child. Like I truly want to collaborate with everyone and I truly want to share. And oversharing knowledge in science sometimes can be a problem because some people don't have the gift of ideas. They have a gift of other things and they will take your idea, so, and not to say that I'm being secretive now, but to say that I learned that, that it's just like being a child in a playground. Not everyone want to play together. Some children want to play by themselves. And being able to understand your professional environment as that playground really helped me understand that stop getting hurt about people not being your best friend or being nice to you or collaborative, but engage with people that are, focus on the ones that are.
Yeah, there is definitely in the profession a lot of people, so you could find people that will best fit your interests or your motivations for sure. Like the profession is big enough. But I'm curious to know if somebody now, wherever in the world they are, they feel inspired and motivated by this talk and say, you know what, I have so much curiosity. I also want to pursue something like that. What is the best first step to start?
That's a good question. I would say first step is write down what's your vision, short-term vision, what's your vision, long-term vision right now. Be clear. Make actually a board. Don't just write down, make a board. How do you ask this question? How do you see yourself? Do you see yourself as an academician? Do you see yourself as a clinician that's successful? Do you see yourself financially successful? Do you see yourself, succeeding like, how can I say, mentally, psychologically, mental health, family-wise? How do you succeed? The other day, I found this notebook, actually. It's so funny that we just spoke this because I saw this morning again. I had many, many notebooks that I do writings and sketch and that I write thoughts just to debrief. And I have here, I don't know in which time of my life I wrote this, but I wrote here like a definition of success. And it was like lifelong inspiration. That was one bullet point. Philosophical freedom. That was the other bullet point. And financial stability.
Nice.
Those were three things. So lifelong inspiration, philosophical freedom, and financial stability. And I put it here in a drawing. It was kind of a drawing put it here. Life is a journey. So I would say start with your writing and understand who you are, understand what you want. And once then you go for your execution, talk to people, ask them questions, and you'll get there because your vision is clear.
That's so important. How many times in life we just engage into things just because without a purpose and the motivation, the passion that comes after moving something forward when you have a purpose.
Yeah. So don't let all the forces drag you, but create your own force. It's like the movie Star Wars, the force is with you.
I love it. What is your purpose today, Marcelo, after everything you've been through? And what are your plans for the future? How do you want to? Because I know you're a person that really wants to impact the world in a positive way, the same way that you are as nature. What is your, at this moment, what is your passion and what is your goal?
Yeah, thank you for asking that. My passion right now, it's impacting healing, human healing through scientific advance. How can we advance understanding of life before disease even happens? Today, we are trained as medical doctors, dentists, surgeons, professionals that work in the biomedical field to diagnose disease, provide a treatment plan, and improve whatever. And that has been incredible advancement. We have imaging, we have molecular, we have a lot of advancement. But I would like to advance and create an impact where we are thinking life before disease even happens. So for example, instead of you doing one every year, your exam, and you find out that you have cancer, and then your doctor calls you, I want to be monitored, create a way that we can monitor life more dynamically. I don't want just a snapshot of your health records. I want like a video, like a whole video of your life. I want a molecular monitoring of our incredible change, dynamic change in the bacteria, in the microbial, or in the immune system and inflammation. Those things give us signals before disease even happens. A tumor to form has a lot of inflammatory cells that signal before it forms that tissue. So, cavities, before it disintegrates, there's a lot of molecular kills that are there. So we just have to open our eyes, clinically and scientifically together, molecular eyes for our clinics, to really see what's happening and help our patient become a field of more diagnostics. So my passion is impact healing, impact, decrease suffering. I don't like seeing people doing, having diseases, doing too many surgical procedures, too many mechanical procedures. I want people to be in the early medicine and precision medicine and dentistry. That's what I really want.
That's beautiful. The true prevention, which is before the action, because all of our trainings and everything that we're doing nowadays are oriented to treatment. How can we do treatment better? And I guess, in a way, I'm thinking back to what you said before that actually impacted me a lot, how the system actually doesn't help the students or the residents to even fulfill, if they have the curiosity, how many people really have the opportunity in residence to do both, like you did, or to really combine. So I think the transformation can come from creating programs that allow people with natural curiosity to really explore both, so that way they can develop.
Exactly. So that's why I wrote here, part of my mission is philosophical freedom. If we allow people to have some level of freedom, they will thrive, they will expand. And I've seen it happen in my life, and I've seen happen in people's lives, so another tip I will give for people that are listening is find good environments. Competitive environments are fine. Struggle will be in a daily basis. But find environments that you have people that are supportive. Like I have people that I mentored through high school. Now they're in college. We still keep in touch. Now they're applying for dental school. I have people that went all the way from high school now to residency, because they were in my lab as a scientist, and now they decide to do the DDS PhD program. So, or MDs, I had MDs in my lab. So find people that will be complete. I had incredible mentors. I had also struggle with some mentors, but don't put all your life in one mentor. Find multiple mentors. Open your portfolio.
Absolutely. Mentors are like, I like to say always, constellation of mentors, because you also need mentors for different moments and different parts of your life. Yeah. And many times asking questions requires that you actually ask the same question to different people, because everybody will have a different perspective, right?
Exactly. Some mentors are equipped with different skills. So take advantage. They are, if they're good and supportive, they will help you sharing some skills, and find a way that you can, if you are more entrepreneur, you want to do a company for dentistry or for dental medicine, then you find someone that did that. If you want someone that want to do science, then focus on someone that's succeeding on that, and find also, the other tip is find sometimes junior mentors as well along the way, peer mentorship. Believe in your colleagues, with similar age, similar status, that they can help you in scenarios better than other mentors, classic older mentors, because
100% agree with that.
your mentors can be really supportive.
Yeah, they can. In terms of mentorship, and just to kind of close up, if a mentee comes to you or somebody that is looking for a mentor advice coming to the United States, what will be that piece of advice that you will give to that international dentist looking to fulfill this dream of America?
Yeah, I would basically, the advice would be a question. What is it that you want to do in your life? Not just get to US. What is it that you want to do? And if I feel there's clarity, then I'm better I can give a better help. I can really provide support. But if there's no clarity, I ask, work on this and get better clarity. So then you can, go towards the steps. And a practical suggestion would be, try to watch movies in English, learn the language faster, listen to the music and, find your way, because that can be a hindering point. And being able to communicate, being able to write, being able to, express yourself is part of an important journey. And it's frustrating when you cannot express and you're feeling misunderstood. So you can prevent that by watching some Netflix.
We could all do a lot of that these days. And that's awesome. Well, thank you so much for your time today. I really enjoyed listening to your story, to a little part of your story. And there is a lot more there. Would you like to say anything else? How people contact you? If people feel very inspired by what you said, is any way to reach out to you?
Yeah, I think we're putting my information on the website. So email me if you have questions, and I'll do my best to reply. And feel free to look, into like articles that I wrote if you have specific questions, or if you want to do things together, or if you need our help and show you as well. We'll be happy to provide, support. We are here as a community.
We're here for all of them. I always tell my students, I'm here for you. And I love that sentence, and I use it now actually as part of the podcast. I always say, like, and remember, I'm here for you, because I mean it. I feel we have to be here for each other. It's very important to be present and being for what the other person needs. But
yeah, for sure. I think it's we only have, the only thing we have is today. The story of past, the story of future is just an illusion. We only have today. The journey is now. So I see the students that thrive the best are the students that are more present. People that are constantly thinking of the next step, the next degree. Don't worry about those things. Worry about what's the best that you can do today. How can you achieve a best day in your journey, in your school, in your class, paying attention, not being the phone. Very often I see this disconnect with technology. So I have strategies myself, and one day we can talk more about it, but how not to be on those places and excessive social media. So try to be present in today, and every day is a building block to a beautiful journey that will be called your legacy. So do it well.
Make sure it's a good legacy. That's all, I guess. We build every blog to make sure that we leave the best legacy we can to this world that needs it so much.
Yeah. I've done mission trips where I went to Africa. I was in the middle of my PhD, and I was treating people that spends the whole night walking barefoot to be there with me because they were in pain for more than 5 years of pain. And pain is part of inflammation and affects your whole system, oral and systemic tissues. So being able to help people remove their pain, treat them, teach them, do better practice, provide help, fundraise, it was part of my, journey, build block, and things that I still do today. And I think it's very important that we realize it's not just about what you get, it's about what you get and what you give, and that creates a good present, a good now, and a good journey.
And a good karma.
Whatever you call, but you create a good life because you are not just collecting. Some people are so focused on degrees. I want degrees, I want accolades, I want awards. Maybe it's time for you to help your friends, provide a letter, provide a support, mentor someone. You want to understand your struggle, go help someone, mentor someone. You understand somebody else, you connect. Human connection creates a lot of learning, so go for it.
Yes. Well, that was amazing. Thank you so much. And thanks again for your time, for sharing a little part of your story. And I guess look forward to see more about what you're doing and then hopefully connect more in the future.
Thank you. Thank you for this platform and providing me the chance to really speak and be philosophically free and talking about the journey and your incredible questions and giving me this time to really share. So I appreciate it.
Absolutely. Thank you.